I'm Dr. Claire Capewell. I'm a consultant in palliative medicine and I work currently in Preston, Chorley and South Ribble. I trained in the Northwest, so I've worked in Bolton, in Lancaster, Preston, Manchester. So I've got a lot of experience of working in the Northwest and with lots of adults with life-limiting conditions. So I first heard about LifeNow some years ago and have followed with interest the newsletters and emails talking about the progression you've been through, really, the different plans, looking at a building, and then as you have then moved in a different direction. And I think it's when the direction changed a little, that's probably when my interest was particularly piqued. I am a consultant in palliative medicine, as I say, and I work in the community. So I generally look after people in their own homes and in outpatient clinics. So that's my area of work, and I do see a lot of need in that area, and I can see a real gap there that would be it'd be helpful if that was filled. I think young adults, in my experience, they generally want to live life to the full, as everyone does, to the end of their life. But particularly for young adults, they seem to me to want to be in their own home with their friends, with their families around them, and to live as normal a life as they can. They often do continue to sort of pursue treatment, even when they're very ill. But I think it's that focus about looking after people in their own homes, really, as opposed to perhaps offering them care remote to where they're living, to where their families are. They may well have young children who obviously they want to be able to see and to continue to care for. Perhaps for young adults, they might see that as off-putting, partly to engage with services within a building, because often the other patients are older, so that can be intimidating. I think that's one aspect. Also, I think that there's a lot of talk about looking after people in their own home, and particularly helping people to die in their, what we call their preferred place of care. So preferred place of care or preferred place of death is where they say they would like to be cared for when they're ill and at the very end of their lives. So there's a lot of talk around supporting that, and there are, of course, some excellent services that go in to try and facilitate that and to give people the choice and the best care that is possible. But there's always room for more in that area. And as I say, I work within the community, so I see a lot of people in their own home and looked after by wonderful doctors and nurses. But there are always times when they are on their own with their families, and there's no such thing really as 24-hour continual cover. So I would certainly see an addition to the current services as a positive thing, and something that would really benefit a lot of patients and families. Something that I've noticed that a lot of patients and families say that is missing is that signposting and coordination of care. Yes. So that's definitely something that can be improved, and we do accept that within current services. And I think that could be a real role for LifeNow, of offering that with coordination. And that might be something that is that you step into and sort out the situation that are in for families and patients, just to feel that there is someone who knows what they're talking about to help them navigate the system. Because the health system is very complex, isn't it? And it can be difficult even as a professional trying to navigate your way around the system, let alone for patients and families who are ill, who are maybe experiencing symptoms, who are having treatment. So I think having that intervention to be able to coordinate things could make a real difference as well. I think we all value relationships, don't we? And again, often patients and families say the things that makes the difference to them is being known and being valued by professionals as well as by family and friends. And that's something that I've experienced sort of through the years that can make a big difference, just having a consistency of care for carers it doesn't matter at what level their expertise is, but just carers, professionals who know that person, who know them as an individual, who know when something's not right for them, can make a big difference in itself. So that consistency of care certainly is something that people value, whatever setting you're looking after them. So I think if that's something that can be achieved, then again, that'll make a big difference for people. It would be great to see someone with a real enthusiasm for this subject, of course. There'll have to be someone who will be able to persevere when things might not be going so smoothly, but they'll have to bring people along with them, won't they? I would say they'll have to be diplomatic as well and be able to work with existing services, and I guess if they have experience of what is currently provided, then that would be helpful. I can think of a lot of examples that I've seen over my years of experience in palliative care of families who would really have benefited from this kind of approach. I'd say each situation is individual, so each situation would have required a different sort of package. I can genuinely see where there would be a big difference being made by the approach that LifeNow would take, both for the patients and their family. And there's an awful lot of distress around young adults being ill and dying, of course. And there's often a lot of people that are involved in their care and who need support. So I've talked quite a bit with your trustees about the kinds of people and the situations where I can see this intervention could have made a big difference. So looking forward to the future, it'd be wonderful to see in a few years' time where those kind of situations will be transformed by the kind of support and coordination that LifeNow could offer. So I look forward to that possibility.